Okay, so what is a risk versus what is a threat? And this is going to be important later on when we talk about hand washing and face masking. Again, this is a topic that we want to cover with you on a weekly basis, at least, because we have a lot of new people joining us on the Zoom, and then a lot of new people are being attracted to the work that we're doing and looking at this after the fact on YouTube or on Facebook. So I want to be able to help you differentiate in your mind what is a risk and what is a threat as you go out into society again, as our communities begin to open back up, their businesses, and we return to somewhat of a more open and less quarantined way of living. So the difference between a risk and a threat, at least the way I'd like you to think about it, is that a risk is somewhat unknown. Okay, so when you are in the presence of a number of people and you don't know whether they are sick or not sick or carrying and asymptomatic, that is a scenario like going into a grocery store, a big box store, and there's a high density of people. Many of them are forced to be within 6 feet of each other, or they have to stand in line for a good number of a good amount of time. That really is elevating your risk level to kind of red. Okay, you're in a scenario where you don't know the condition of the environment around you. You don't know how many people are carrying or maybe sick, etc. So that's kind of a red. A yellow is more akin to, you're in an open area and you're walking around a park. It's a busy sunny day, so a lot of people are attracted to that area. It's open air, but you're in the presence of a lot of people that you don't know. So in that event, that is somewhat you should consider as a kind of a yellow area of risk. A green area is you are at home. Okay? You control your environment. You control how clean it is. You control what comes into it. You control who comes into it. You know the status of the people around you as having not been sick or tested or whatever. You have full control over the risk in that environment. That is a green environment. And why am I telling you this? Well, I don't want you sitting at home or in your car or even in your yard with a mask on, because that is an insensible way of dealing with risk. The sensible way of dealing with risk is obviously when you go from green to yellow and come back, then you do the things that you should do to preserve that low level of risk for yourself, which is hand washing, removal of a contaminated mask, taking a shower if you've come back from an area where there were hundreds of people, like a red scenario where you're in an overcrowded big box store, an overcrowded grocery store, and you just kind of feel the crush of humanity around you. Then you should come back to your green environment and decontaminate. Okay, so that is risk when you're dealing with the unknown. Okay, so threat. What is threat? Threat is something that's somewhat known, and a lot of people have approached me about can I go see my doctor now? I have to go and see my dentist. I've got this problem. I need to. I've been nursing a sprained or swollen ankle. Lots of people have approached me saying, I'm really scared to go to the hospital or the ER or the doctor. And to them, I've said, you're right to be scared. Okay, I should say you're right to be very, very cautious about that. And that was the advice given over the last 6 weeks. But now, again, hospitals are opening up to elective procedures. Doctors are beginning to see their patients on a more regular schedule, dentists as well. And so you need to be able to assess, am I going into an environment where I'm at threat? Not risk, threat. Threat is, I want to give you the example. Physician friends of mine have been using the example of having to use a limited amount of personal protective equipment and repeatedly go back into the same room to examine a patient. Okay, but different patients. So every time a suspected COVID patient is brought in, they're examined in the same space, and over the course of a day, they may see 10 or 15 patients in the same space who are all COVID suspects, right? Suspected to be positive for COVID, untested, but coughing and sick. That exam room is a threat to everyone's health, okay? And so that's a threat, not your grocery store or your convenience store, because that's an unknown situation. And we're hoping that most of the people that are sick or have been sick or, understand now that they should not be out in public. That's not completely, reliable, of course. There's going to be a lot of people that are asymptomatically carrying the virus. That's the only way it could have spread this far and wide. But the exam room is the example of a threat. You're going into an ER. You need to be very cautious about that kind of environment, and really only let healthcare workers deal with threat. Okay, you deal with risk. You deal with assessing your risk on a daily basis. You deal with transitioning from red to yellow or yellow to green or whatever, and doing the appropriate things to make sure that you don't put yourself in a position to acquire the illness. All right. So that now totally different than risk and threat is who is at risk or what is being at risk. And we were talking about this just before we began. At risk continues to be those over the age of 65, those with long-standing obesity, diabetes, and cardiovascular disease. And to a certain extent, also those with pulmonary disorders like asthma and COPD. But we're learning that cardiovascular risk is actually more risky to have and be around someone that's sick or potentially put yourself at risk than the pulmonary stuff. So what, again, threat level, let healthcare research workers about, biological safety levels and cleaning the hospital environment, cleaning your doctor's offices, because we're trained, we know how to eliminate threats so that each patient, is kept safe. And again, I'm taking too long on this slide, but someone wanted me to use the example of if you're a soldier and you're entering a Taliban village, it doesn't matter if there's 20 fighters or if there's 30 or if there's 40. You are under threat, and you know that there's a threat in there. So that's the way you deal with risk and threat. There are way too many variables to assess for the general public to say, oh, this is a threat to my health. That's why we want you to understand the red level of risk is going and getting a haircut and sitting in a waiting room with 6 other people, and they're all 3 feet away from each other. You're putting yourself at high risk. Yellow is going for a walk in a crowded, semi-crowded park and kind of trying to make sure that you are 6 to 12 feet away from people. And green is being, around people that that you've known not to be sick for 6 weeks or more, or in your home. Any questions?